Listen to this title and tell me what initially comes to mind for you. I'll tell you what comes to mind after I go through this page. Rich countries are importing a solution to their nursing shortages, and poor countries are paying the price. As U.S. healthcare workers quit in droves, record numbers of migrant nurses from the Philippines and elsewhere are filling the void. As you listened to that, what comes to your mind? What comes to my mind are two different things: colonizers going to underdeveloped countries to take their resources and make them poor, whilst giving them little tokens of appreciation, and the passport bro movement, where they are going to underdeveloped countries scooping up women that might be in poverty and then either staying there, giving them trinkets whilst getting a few of the benefits of being with that woman, or importing her like a mail order bride. That is what I initially thought of when I saw this title. But you guys, let's jump into the rest of the article. It all happened so fast for Diane May Gamboa. One day in March 2022, she walked into the U.S. Embassy for an interview. A few days later, her visa was approved, her passport was stamped, and a green card was on its way. There was a nursing job waiting for her at a long term care facility in New York, some 8,700 miles from her home in Puerto Princesa, a city tucked away into a shimmering bay on the white sand of Palawan. Gamboa, then 35, would soon be heading to the United States, where a crisis was unfolding. Wave upon wave of COVID infections had eviscerated staff at hospitals and nursing homes across the country, leaving them reaching for increasingly desperate ways to cope. Nurses were loaded up with ever more patients, straining the limits of safety. Shifts were stretched beyond the standard 12 hours. In Washington state last October, a nurse called 911 from inside an understaffed emergency room, pleading for support. We're drowning. Gamboa, nervous and excited, felt swept up by the speed with which the U.S. system pulled her into work in the country, even if it scares me. So you see where I started with the parallels. During the early days of COVID 19, during the early days of the COVID 19 pandemic from February to April 2020, the U.S. healthcare sector shed more than 1.5 million jobs, according to the U.S. Bureau of Labor Statistics, nearly 10% of the total healthcare workforce at the time. And a significant nursing shortage is set to grow significantly worse in the coming years. Research published in April by the National Council of State Boards of Nursing and the National Forum of State Nursing Workforce Centers found that 100,000 nurses had left the profession in the past 2 years, and an additional 800,000 nurses intend to leave by 2027, citing stress and burnout. To bolster their workforces, hospitals in the US and Europe have dramatically accelerated hiring from countries like the Philippines, India, Nigeria, Zimbabwe, and Jamaica. These countries have long sent trained, experienced nurses to work abroad, but since the start of the pandemic, what was once a trickle of nurses leaving their home countries has become a flood. And think about the resources that these countries are missing because their people, their women are leaving. So this goes to show what happens when a country is underdeveloped or undeveloped and they don't work on creating an infrastructure or the opportunities for the people to stay here in their country, stay there in their country. What I also see when I think about these parallels are the people leaving rural American states to go to work in urban centers or urban communities. This is how these migrations happen. And that is the reason why it is important to build up the place where you are, your city, your state, your country, so that people don't leave for other opportunities. We spoke with more than 35 nurses, along with recruitment agency employees, hospital officials, public health experts, government health agencies, and researchers. Our investigation found an international bidding war for healthcare workers, yielding opportunities for some nurses, but exposing others to exploitation and leaving poor health systems scrambling to cope. AMN Healthcare, a staffing agency based in Dallas and one of America's largest international recruiters, said that the number of foreign nurses it placed in U.S. hospitals has increased by 300% since the start of the pandemic. The UK, facing similar staffing crisis, created a new visa that fast-tracked applications and reduced fees to make it easier to fill positions with nurses from overseas. Other European nations made similar moves. Last fall, Germany struck a deal with the Philippine government to hire hundreds of nurses and provide specialized language classes, while Finland set a target of hiring 20,000 international nurses by 2030. So these countries are just letting their women leave. And yes, I'm saying women because typically nurses are women typically. And it's baffling to me. This is not a trickle. They are leaving in droves. And those countries are going to continue to suffer and become poorer and poorer, just like the countries that have allowed other countries to come in and colonize and mine for resources and mine for gold. Some people get rich in these countries while the inequities become wider and wider. Look at this graph right here. This is the U.S. healthcare labor force and how it dropped. So y'all see that line that's going up from 2014 to 2020 is going up, 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 dramatic drop, like a roller coaster drop. And then it started going up, up, up again. So what is going on in the United States as far as the medical community, the nursing community, is not sustainable. And the pandemic exacerbated the issues that are going on in the medical community. And instead of fixing the problem, they are just importing recruitment replacements. That is all that they're doing. And what is going to happen after these women become acclimated to this country and they get tired and burnt out? They're going to quit as well. The numbers are going to continue to drop because the initial issues are not being fixed within this country. But by the same token, the countries that we are pulling these nurses from will continue to devolve, dwindle down to even worse proportion. In the Philippines, nurses' salaries can be as low as $360 a month, a fraction of what they can make in the US. In Nigeria, the burdens of a failing hospital system weigh heavily on nurses who described working without electricity or basic medical equipment. Many nurses dream about the higher education and career advancements that may be available to them abroad. Look at the sparsity of this primary care center in Lagos below. But the current demand for nurses in the US and Europe has exacerbated imbalances in the global healthcare system and exposed nurses to exploitation and abuse. In India, our investigation found a network of recruiters who twisted the prospect of jobs into a means to exploit nurses hoping to go to the UK. In the US, we found foreign nurses coerced into patching up a system so broken, domestic nurses are leaving it in droves. And in Nigeria, we saw how the exodus of nurses has caused the nation's fragile healthcare system to crumble further with little aid from countries benefiting from the people's labor. Like I said, I'm not going to, you guys get the picture. This is a long article, but I see so many parallels, but it all boils down to colonization and taking somebody else's resources instead of creating the networks here in the United States and in the UK and fixing our system. We're just patching it up with the resources of another person's country, another people's country. You guys, let me know what you think about this. Jump in the comments. Let me know what you think. Like, comment.